20 silent diseases that show no symptoms. Many of the most dangerous health conditions don't start with pain or obvious warning signs. In fact, some can quietly develop for years while your body appears completely normal. By the time symptoms finally show up, the damage may already be serious. Here are 20 silent diseases that often go unnoticed. 1. High blood pressure. High blood pressure, also known as hypertension, is often called the silent killer because it usually develops without noticeable symptoms. While you may feel completely fine, it can slowly damage your blood vessels, heart, and organs over time. If left untreated, it significantly increases the risk of heart attacks, strokes, and kidney failure without warning. 2. Type 2 diabetes. Type 2 diabetes can develop gradually, often without clear symptoms in its early stages. Your body becomes resistant to insulin, causing blood sugar levels to rise silently over time. Many people don't realize they have it until complications appear, such as nerve damage, vision problems, or kidney issues, making early detection critical for long-term health. 3. Chronic kidney disease. Chronic kidney disease often progresses quietly, with no obvious signs until significant damage has already occurred. The kidneys slowly lose their ability to filter waste from the blood, leading to dangerous toxin buildup. By the time symptoms like fatigue or swelling appear, the condition may already be advanced and require serious medical intervention. 4. Fatty liver disease. Fatty liver disease occurs when excess fat builds up in the liver, often without causing noticeable symptoms. Many people live with it for years without realizing it, especially if it's not linked to alcohol use. Over time, it can lead to inflammation, liver damage, or even cirrhosis if left unmanaged and untreated. 5. Osteoporosis. Osteoporosis weakens bones slowly over time, making them fragile and more likely to break. The condition develops silently, without pain or warning, until a fracture suddenly occurs. Many people only discover they have osteoporosis after a minor fall results in a broken bone, highlighting how quietly it can progress. 6. Glaucoma. Glaucoma is an eye condition that gradually damages the optic nerve, often without early symptoms. Vision loss happens slowly and may go unnoticed at first, especially in peripheral vision. If untreated, it can lead to permanent blindness, making regular eye exams essential for detecting it before irreversible damage occurs. 7. Hepatitis B and C. Hepatitis B and C are viral infections that affect the liver and often remain silent for years. Many people don't experience symptoms until significant liver damage has already developed. Over time, these infections can lead to cirrhosis, liver failure, or cancer, making early testing and diagnosis extremely important. 8. Sleep apnea. Sleep apnea is a condition where breathing repeatedly stops and starts during sleep, often without the person realizing it. While some may notice snoring or fatigue, many cases go undiagnosed. Over time, it can increase the risk of heart disease, high blood pressure, and other serious health problems. 9. Thyroid disorders. Thyroid disorders, including hypothyroidism and hyperthyroidism, can develop slowly and subtly. Symptoms like fatigue, weight changes, or mood shifts are often mistaken for normal life stress. However, untreated thyroid issues can affect metabolism, heart function, and overall health, making early detection important. 10. Colon cancer. Colon cancer can develop silently in its early stages, often without noticeable symptoms. Small growths in the colon can slowly turn cancerous over time. By the time signs like bleeding or pain appear, the disease may already be advanced, which is why regular screenings are crucial for early detection. 11. Ovarian cancer. Ovarian cancer is known for having very subtle or no early symptoms. When symptoms do appear, they are often vague, such as bloating or mild discomfort, and can easily be ignored. This makes early diagnosis difficult, and many cases are only discovered at later, more serious stages. 12. Prostate cancer. Prostate cancer often grows slowly and may not cause noticeable symptoms in its early stages. Many men live with it for years without realizing it. While some cases remain harmless, others can become aggressive, making regular screening important, especially for those at higher risk. 13. Peripheral artery disease. Peripheral artery disease occurs when blood flow to the limbs is reduced due to narrowed arteries. In early stages, it may not cause obvious symptoms. Over time, it can lead to pain, poor circulation, and increased risk of heart attack or stroke if left untreated. 14. Early stage lung disease. Early lung diseases, including chronic obstructive pulmonary disease, COPD, often begin without clear symptoms. Damage to the lungs can occur gradually due to smoking or environmental exposure. By the time breathing problems become noticeable, significant lung function may already be lost. 15. Atrial fibrillation. Atrial fibrillation is an irregular heart rhythm that can occur without noticeable symptoms. Some people may feel nothing at all, while the condition quietly increases the risk of blood clots and stroke. It often goes undetected until complications arise, making monitoring heart health important. 16. Iron deficiency anemia. Iron deficiency anemia can develop slowly, and early symptoms like fatigue or weakness are often overlooked. As iron levels drop, the body struggles to produce healthy red blood cells. If untreated, it can affect energy levels, concentration, and overall health without obvious warning signs. 17. Pancreatic cancer. Pancreatic cancer is particularly dangerous because it often shows no symptoms in its early stages. It can grow silently and spread quickly before being detected. By the time symptoms appear, such as pain or weight loss, the disease is often advanced and harder to treat. 18. Skin cancer. Early stages. Early stage skin cancer can develop without pain or noticeable discomfort. Small changes in moles or skin texture may go unnoticed. Over time, these changes can become more serious, which is why regular skin checks are important for catching abnormalities early. 19. Chronic inflammation. Chronic inflammation can exist in the body without obvious symptoms, slowly contributing to various diseases over time. It is linked to conditions like heart disease, diabetes, and autoimmune disorders. Because it often goes unnoticed, it can silently damage tissues and organs over long periods. 20. Heart disease, early stages. Heart disease can begin silently, without chest pain or clear warning signs. Plaque can slowly build up in the arteries, restricting blood flow over time. Many people don't realize they have heart disease until a serious event like a heart attack occurs, making prevention and regular checkups essential. Your body doesn't always warn you when something is wrong. Sometimes the most dangerous problems are the ones you never feel. Make sure you're subscribed before you miss the next one.